Hi, I'm Rebecca Choate, BOC orthotist from Mercy Springfield, and I'm going to show you the correct way to measure and fit a Miami J collar. When you pull the Miami J collar out of our Omnicell, on the back there's a sizing chart, and it's usually by a patient's silhouette. This patient is going to wear a short collar, and let's get started. The way we do this is we take the back piece. To put the back part of the collar on, you press down on the bed, making a valley, keeping your hand between the back of the collar and the patient's neck, using your other hand to steadily slide it under. That way you don't hook the patient's hair or catch a line that might be back there like a drain tube. And then you just bring it around and you pull your belts up tight to make sure that they're even, so you know the back part of the collar is even. To put the front piece on, you take the collar, and I call it the wings, you spread them out, you slide it, scoop it up underneath the patient's neck, you bring it around and you contour it, hooking blue on blue. You can bring it back around and re-scoop it to do the other side, and then you hook the blue on blue and make sure that your belts are even. When you squeeze and push up, that gives more support for the patient's head and neck. And that way, if they need to turn, they'll have to turn at their waist to be able to look around, and they won't be able to turn their head. They'll still be able to move their head a little bit, and they'll still be able to open their mouth. Can you open your mouth? To eat. But you want to have a snug fit. Some people are claustrophobic. If they are, I usually just let go of the Velcro and kind of let it relax on each side. And then I hook it again, and sometimes I'll just kind of pull that out a little bit. It really doesn't change the position, but the patient thinks it feels better.
Go ahead.
If you come into the unit and you see a patient wearing one of these and this little sternal pad is gone, it's because when they came in as a trauma, if they think they have trauma to their chest, they take this sternal pad off because it puts pressure on their chest. And they can go without that pad if they're 30 degrees or lower in the bed. But once they become 30 degrees or higher in the bed, this pad has to go back on because it's part of their support. So always make sure that they have this pad. If they don't, you dig around and find it or call physical therapy so that we can get you one. But they have to have this pad if they're going to start getting up and moving around. To take the collar off, you just unhook your belts on each side. You slide the collar off, put your hand on the patient's head, and slowly bring it out. And that's how you take it off. Very simple. With the Miami J collar, the shiny part of the pad is always against the skin. The dull part is what sticks to the Velcro. If you try to stick the shiny to the Velcro, it won't stick. So you know that you've got it on backwards. Whenever the doctor tells them they can shower, they'll shower with this on because they're wearing it 24/7. And they can come out, they can lay down on the bed, they can take the wet collar off. And I always instruct them until you know which pad goes where. Take one pad off and put a clean pad on. Don't take them all off and throw them in a pile, because then that's how the pads get put on wrong. And you can take those wet pads off, put dry ones on, take the wet pads to the sink, rinse them with cold water, squeeze them and lay them flat to dry. These are not machine washable or dryable. They will disintegrate the very first time you put them in the washer or dryer, even in a garment bag. They're just not made for that. But you can take a shower every day and rinse these pads out and keep reusing them. We usually give one set of extra pads, and they will last as long as they need to use the collar.